Hodgkin lymphoma, also known as Hodgkin's lymphoma, is a type of cancer that originates in a lymphatic system, which is a part of the immune system. It is characterized by the presence of abnormal cells called Reed-Sternberg cells. Hodgkin lymphoma is less common than non-Hodgkin lymphoma but is generally considered to have a good prognosis with appropriate treatment. Types: Classical Hodgkin lymphoma, nodular sclerosis, the most common type, featuring large, thickened lymph nodes. Mixed cellularity, characterized by a mixture of different types of immune cells. Lymphocyte-rich, features a high number of normal lymphocytes and fewer Reed-Sternberg cells. Lymphocyte-depleted, rare and often more aggressive, with fewer normal lymphocytes and more Reed-Sternberg cells. Nodular lymphocyte-predominant Hodgkin lymphoma, the less common type with distinct characteristics and generally the better prognosis than classical Hodgkin lymphoma. It is marked by popcorn cells and a different pattern of disease spread. Symptoms of Hodgkin lymphoma can vary but commonly include swollen lymph nodes, painless swelling of lymph nodes in the neck, armpits, or groin, fever, persistent or recurrent fever without an obvious cause, night sweats, profuse sweating during the night, often drenching clothing and bedding, weight loss, unexplained weight loss of more than 10% of body weight, fatigue, persistent tiredness or weakness not relieved by rest, itchy skin, general itching, though less common, pain in the lymph nodes after drinking alcohol, the less common but characteristic symptom. Diagnosis: physical examination. Healthcare providers may perform a physical exam to check for swollen lymph nodes or other signs. Imaging tests. Chest X-ray, to look for enlarged lymph nodes or tumors in the chest. CT scan, provides detailed cross-sectional images to detect the extent of the disease. PET scan, helps assess the activity of a lymphoma and determine its spread. Biopsy. Excisional biopsy, removal of an entire lymph node or part of it for examination. Core needle biopsy, removal of a small sample of tissue from a lymph node. Bone marrow biopsy, to determine if a lymphoma has spread to the bone marrow. Laboratory tests. Blood tests, to check for anemia, infection, or other abnormalities that may indicate lymphoma. Staging: Hodgkin lymphoma is staged based on how widespread the disease is. Stage I, involvement of a single lymph node region or a single extra lymphatic site. Stage II, involvement of two or more lymph node regions on the same side of the diaphragm or localized involvement of an extra lymphatic site. Stage II, involvement of lymph nodes on both sides of the diaphragm, possibly including the spleen. Stage IV, widespread involvement of one or more extra lymphatic organs, e.g., liver, bone marrow. Additional classification may include the presence of symptoms such as fever, night sweats, or weight loss, referred to as A or B classification. Treatment for Hodgkin lymphoma depends on the stage, type, and individual patient factors. Chemotherapy, often the primary treatment, involving a combination of drugs to kill cancer cells. Common regimens include adriamycin, bleomycin, vinblastine, dacarbazine. Radiation therapy, used in combination with chemotherapy or as a stand-alone treatment, particularly for early-stage disease or residual disease after chemotherapy. Stem cell transplant. Autologous stem cell transplant involves harvesting the patient's own stem cells before high-dose chemotherapy and then reinfusing them. Allogeneic stem cell transplant uses stem cells from a donor and may be considered for relapse or resistant cases. Targeted therapy, medications that target specific molecules involved in the growth and spread of cancer cells. Examples include brentuximab vedotin and checkpoint inhibitors like pembrolizumab or nivolumab. Immunotherapy uses the body's immune system to fight cancer. Newer treatments and clinical trials are exploring this approach. Prognosis: early stage Hodgkin lymphoma generally has a good prognosis with a high cure rate, especially with modern treatment approaches. Advanced stage Hodgkin lymphoma prognosis can be variable but often remains favorable with appropriate treatment. Follow-up care: regular monitoring, periodic check UPS and imaging to monitor for recurrence or long-term effects of treatment. Managing side effects: addressing any ongoing effects of treatment, including managing fatigue, secondary infections, or other health issues. Conclusion: Hodgkin lymphoma is a treatable cancer with a generally favorable prognosis, especially in early stages. Advances in treatment and supportive care have significantly improved outcomes for many patients. If you or someone you know is diagnosed with Hodgkin lymphoma, working closely with a healthcare team to determine the best treatment plan is essential for optimal management and recovery.